Hi there. My name is Jen Stanton, and I had gestational diabetes when I was pregnant with my daughters. That was a long time ago. They are now 16 and 18 years old. And I joined the Diabetes Sisters community because I was just really in need of information, of support, and encouragement. And I have not been disappointed. I will say that. I've been now hosting meetings for 8 years, and I am really thrilled to be one of your hosts for the Gestational Diabetes Support Group.
I'm Jennifer Smith. I'm a registered dietitian, certified diabetes care and education specialist. I'm the director of lifestyle and nutrition and women's health within integrated diabetes services. And my connection to gestational diabetes started, gosh, a long time ago. It was kind of my first, along with type 2 diabetes, sort of my first kind of movement as I became a dietitian and a diabetes educator into really working more of a women's health kind of angle and understanding what was needed within the diabetes community. And my involvement essentially with Diabetes Sisters really came because of my own. I live with type 1 diabetes myself. I've had type 1 for 37 years. And eons ago, when Diabetes Sisters first came about, it was very type 1 focused. And thankfully, now we've kind of moved on out and incorporated all types of diabetes for women, which is fantastic. But that was my first real connection to just women with diabetes. Um, and I love helping women navigate pregnancy within my practice. I work heavily with women with type 1 diabetes, but again, years ago in early practice, it was all about gestational diabetes. And really, I love working with the group of women navigating diabetes in pregnancy because there's this beautiful end result of really wonderful management that I have the ability to help coach somebody through. And I think Diabetes Sisters does a really wonderful job through support groups and everything to kind of keep that momentum and that energy towards the positive management kind of going, which is, it's great. Support is wonderful whenever you're living with something that you have to navigate day after day, right? So
Mhm.
so tell me a little bit about since your daughters, right, are
Yes,
16 and 18,
yes.
what was your experience like with gestational diabetes so many years ago?
I'm not that old.
No, I understand.
um, it was a frightening time, especially with my first pregnancy, because I was trying to learn everything I could about pregnancy and how to be a good mom while I'm still pregnant and carrying her. And then, I wasn't expecting gestational diabetes, and that just sort of threw a wrench into everything. And I'll tell you, I was I was pretty frightened because I already didn't know what to expect with being pregnant and giving birth and all of that.
Mhm.
And so then trying to navigate that with um, with gestational diabetes, it was a little bit tough because I didn't know anybody who had diabetes. I didn't know much about it. And so everything in my life was new for the very first time, trying to figure everything out. So I did not come across Diabetes Sisters until probably 2 years after my second daughter was born, because
Oh,
that is when I was diagnosed with type 1 diabetes. I really wish that I had known about Diabetes
yeah.
Sisters at the time while I was pregnant, because it would have been life-changing. I would have felt that support that I needed. I would have had that information that I was craving, that
Mhm.
knowledge. I would have known what to expect. I would have had a lot of questions answered, And especially, is this okay? Is this normal? Is this what's supposed to happen? And it would have been extremely comforting. So
Yeah.
I'm thrilled that we're doing this now. That's why I wanted to be a part of it, because I know how much support and encouragement it brings to women.
Absolutely. I think a thing that I often have heard, despite not really working with gestational heavily right now, I work a lot more
Mhm.
with type 1 in pregnancy, but still, I think there is type 1, type 2, gestational diabetes. There's always that concern piece within pregnancy. And I think that gestational, when you were diagnosed with it, it sounds like there also wasn't a lot, not only not support, you didn't know anybody with diabetes at all,
Right.
but also the education that you got was probably pretty few and far between in terms of this is what you can do, this is the checkpoint, this is who to check in with. Today's world, we have so much technology.
Mhm.
It's almost like an information overload. It's like, what do you do with all of the information that you could possibly have? And in today's world with gestational diabetes, we at least use finger stick blood glucose monitoring.
Right.
And we're
Right.
at least using it multiple times a day to give pinpoint information for that lifestyle adjustment, which is really the first step with gestational diabetes. But then we also very heavily rely on continuous glucose monitoring.
Yes.
And while it wasn't around really when you were diagnosed with gestational to begin with, did you do any kind of monitoring or any were checks mostly in with your doctor? How did they know how well you were doing?
Well, it's an interesting question, and you're right about the technology not being there, because um, my oldest daughter was born in January 2007, which is the same year that the iPhone was invented. So
Yeah,
so there you go. There was not a lot of technology available at our fingertips. I couldn't just Google on the go.
no,
But, at that time, my doctor just had me, uh, treating, I guess, diabetes with healthy food choices, and
the
had me.
lifestyle changes
Yes,
essentially.
exactly. Lifestyle changes had me counting my carbs, but I wasn't even told to monitor, my sugars. I wasn't told to, like, use, a glucose meter to check my sugars or anything. Certainly, I did not have access to a continuous glucose monitor, or a CGM, back at
Sure.
that time. Yeah.
Yeah. Yeah.
And, I wish I had, because knowledge is power. And when you have that information, you can better take care of your body and your baby inside of it. So yeah, it was just, I just did lifestyle changes, like you said. I would walk and watch what I ate. And so yeah, it was a very different time, but it was
Definitely.
a lot better than, previous times for others who were dealing with diabetes, so I can't complain too much.
No, and if they had seen anything, I'm expecting that they did blood work and everything for just evaluation within your checkups to see where are things. I mean, those are some of the common questions that a lot of people with gestational have. What am I supposed to be paying attention to? And again, today, compared to your experience, there is blood glucose monitoring, at least
Mhm.
those finger sticks. And we really give women good information to know where should those numbers be. You were doing a really great job with lifestyle change. Being able to have actually even just finger sticks at your point would have given you even more motivation to
Mhm.
stick with those lifestyle changes you were trying so hard to, put into habit.
Right.
Then you can get an effect of, well, goodness, maybe, a bowl of yogurt ends up being better than a bowl of oatmeal with honey on top of it, right? So
Right.
get a little bit of a checkpoint there. So, with gestational, again, we do have good technology that we can use today,
Mhm.
which is important. And, hopefully people can get access to that easily.
Yes.
So in In terms of after you were diagnosed, were there, I know you got kind of connected with Diabetes Sisters after your second,
Mhm.
mainly because of a new type of diabetes diagnosis, it sounds like,
Yes.
right?
Yes.
But I mean, during your pregnancies, though, you still really didn't have any peer support at all.
Exactly. And that was tough. Um, like I had said before, navigating through your first pregnancy, you really don't know what's happening. You don't, I mean, I had the
You
book,
have
What to
nothing to
Expect
compare it to.
when you're exactly. And then, with gestational diabetes on top of that, I really just didn't even know what that meant. I didn't have anyone in my life who had gestational diabetes that I could talk to. Um, I think I pulled out a book on diabetes from the bookstore, the library, and just thumbed through it and thought, okay, this really isn't applicable to me because it's not about gestational diabetes.
Right.
And, some of the eating habits, lifestyle changes were the same, of course, but it was just really, it was difficult. And that's why I say that I'm so excited that Diabetes Sisters is doing this, because the support and encouragement is everything. It makes just a world of difference. I mean, you feel like, okay, I can do this. Um,
Mhm.
I've learned so much from these women and meetings I've attended, meetings I've held. And I can truly say that I've learned more from these women than my own endocrinologist. I know that's not the best thing to say,
No.
but it's really true. And with you've been living with diabetes as well. So I think that you would be a fantastic doctor to go to. My endocrinologist, um, I felt as though he was up on some of the current things. Maybe if he had gone to a seminar or did like continuing education classes for his medical license type of thing. Um, but these women, they're living day
Yes.
by day, day to day with diabetes, and they're not just living with it, they're thriving with it.
Right.
And I often joke that it shouldn't be called diabetes, it should be called livabetes, because you can just thrive with diabetes. The more
Yeah.
you know, the better you can do. And the support, the education, the encouragement, it really is everything.
And it's also a place that, with encouragement and support, which is, it's hard to hear that you didn't have that in
Mhm,
your first round of experience with gestational diabetes, right?
mhm. Right.
Because it does make a very big difference in terms of even understanding how to talk with your care providers. If you have
Mhm,
a support group or a network of women, men, anybody that you can talk to about your experience and what their experience is, oftentimes you go back and forth and say, well, why don't you talk to them about it this way or ask it this way or bring
mhm.
these reports? Maybe you never thought to bring your data in. You bring it
Right.
in, gosh, it opens up a whole world of discussion with your endo that maybe they didn't even think about because they didn't know that you were concerned about something in general. But I think
Mhm,
those are the talking points in a diabetes specific group that become valuable then in learning how to actually advocate in
mhm.
your clinical experiences. Even in many of the support groups, learning about new technology
Yeah.
and new devices and what's out there and what's even new studies and things, whether it's for gestational diabetes or medications during pregnancy with diabetes. Oftentimes it's the peer groups that know more because
Mhm.
somebody in a larger peer group has usually tried something.
Right, right.
So it makes a big difference.
It really does. And like I said, the tips and tricks that I've learned from these women have been invaluable. And they aren't just from reading about them or learning about them. They are by trial and error.
Right.
And in real time, in real life, and this is what happens if you did this, but you know what? This really helped. And of course, everybody's body is different. but just learning some of those, it's just made
Yeah.
such a difference. And, you know, also talking with like-minded women who really get it,
Yeah.
because they live it.
Yeah.
And I feel like you can tell people what it's like living with diabetes. You can explain to them, they can read about it, they can observe you, but it's like riding a roller coaster. You can tell someone what it's like, but they don't actually know until they ride it.
Until they right.
Yep.
Absolute. Yeah.
And so these women who are also living with diabetes, they get it because
Mhm.
they're on the ride too.
Right. And the other thing that I think that as a community, you can understand again once you live with it, for those with gestational diabetes may not feel like they have a connection point with those who have type 1 or type 2.
Mhm.
Honestly, that connection it's still similar enough,
Mhm.
mainly because those people who have been living with diabetes may have some of the best tips and tricks that help
Mhm.
you navigate through the rest of your pregnancy in a healthier way.
Yes.
That may set you up with healthy lifestyle changes that beyond pregnancy with gestational, when technically it's supposed to go away, right?
Mhm.
Once you have your
Mhm.
baby and several weeks later, all the testing gets done, and yes, yay, I don't have diabetes anymore. But now you've changed some lifestyle things to the better that
Mhm.
you can stick with,
Mhm.
which hopefully will be preventable, or prevention really for later potential type 2 diabetes, right?
Right.
I mean, you have a very interesting story, one that I've definitely heard before, but gestational diabetes and then a diagnosis of type 1 diabetes.
Right. Right. And
So,
yeah, it was interesting. So, I had gestational diabetes with both of my pregnancies. And then 2 years later, I was told that I had diabetes and they put me in the hospital. I had an endocrinologist that did not run the antibodies test, and I was 39 years old. And he said, because you're 39, you have type 2. I really didn't even know that there were different types. My
sure.
sister is a nurse, and she said, well, what type do you have? And I said, I don't know. And that prompted me to ask the endocrinologist, and he said, you have type 2. And then a year later, I found out after having testing done by a different doctor that I had type 1. And so it's been a road, but Diabetes Sisters has really been there for me and helped me through it. And you're right. Having type 1 diabetes or type 2 diabetes or gestational diabetes, the majority of them, I mean, they require lifestyle changes, and
Correct.
all of them benefit for all
Mhm.
types of diabetes benefit from those
Yeah.
lifestyle changes. And even if you have gestational diabetes with your pregnancies and then the diabetes is gone and you never hear that word again related to your health, you have still made these lifestyle changes that are going to help to prevent heart disease,
Great.
um,
Yeah.
all types of things because you have learned a better way to take care of
You've
yourself.
learned to add exercise or something
Mhm.
active to your day. You've probably learned what real food is versus this is a treat, it's not really food, and there's a
Right,
difference there, and I'm going to fuel this way and maybe occasionally do this type of thing, right? And
right.
those hopefully stick with you long term. And you're right, they are very preventable for other health conditions, even if you
Mhm.
never have to worry about checking your blood sugar ever again.
Right, right. And living, a lifestyle with diabetes and to make you your healthiest you is, the diabetes lifestyle, I think, is probably the healthiest that anyone can live. So, kudos to you for having diabetes, all of us, because we have learned great habits and made great lifestyle changes that others are going to wish that they had someday or will have to make eventually one day also.
Absolutely. I think those day to day, the changes in the things that you do learn. And again, sounds like you did a lot of digging for information
Mhm.
and weren't really set up despite being told, hey, you've got this condition. And wasn't really well explained to you from what I'm hearing you say. And you did digging and reading in books, and you said, well, I guess this is what I have to do. And you navigated, it sounds like, two beautiful, healthy kiddos. So
Yeah.
good job.
Thank you.
And I mean, sincere, really, I mean that a lot because I know what it took to navigate knowing what I know and going
Hmm.
into planned pregnancies with diabetes.
Hmm.
There is a lot to navigate in management. And again, thankfully, today with the technology we have, it makes it a little bit easier for those with gestational to make even better lifestyle changes because there's
Hmm.
more visibility to what that change is providing in terms of benefit or change, and may even be able to navigate showing somebody, I've done all the lifestyle changes. Hey, doc, this isn't doing everything. I'm still well above the target range. I'm concerned. Do we need to talk about adding medication at this point? Right. Um,
Right.
and that's really valuable. It used to be an oral medication that was sort of the hallmark first step.
Hmm.
And now, really, if lifestyle changes aren't doing it, really, they're looking now as the first step of moving someone to using insulin. Um,
Hmm.
and I think there's value in knowing that you haven't failed. If
Hmm.
you tried all the lifestyle changes and you still need medication, insulin, or whatever, you haven't failed. You've
Right.
actually made some really good steps in a right direction, and now you need something else in your toolbox to
Yes.
help. So
Hmm.
I think that's valuable to make sure people understand.
Absolutely, absolutely. And I think one of the most important things that you can do is advocate for yourself. If you're questioning, if you have that gut feeling, you're not sure, if you're confused, if you just want some guidance or direction, absolutely advocate for yourself. Talk to your doctor. Say, this is what I'm feeling. This is what I'm thinking. This is, even if you don't know what you need,
Right. Yeah.
talk about it. That's advocating for yourself and just say, I'm feeling this way. I mean, there's days that you could be feeling burnout or just tired of dealing with anything. And talking about it is so helpful. And that's where you learn ideas. That's where you learn tips. Talk to your doctors. I'll tell you, um, this was after I had both of my daughters, but and I was told that I had, type 2 slash type 1 diabetes. I just broke down on the phone with my sister one night and I was just bawling and I said, I just can't do this. I still did, I didn't know anybody who was living with diabetes. I didn't know what to do and no one understood. Now, my sister, she is a nurse, and so she understood some of it. But I think the emotional toll that I was feeling, just it's like you don't know until you're on that roller coaster,
Right.
right? And so she picked up her iPad. She was living in California. We were on the phone. She picked up her iPad and she typed in diabetes support for women. And she found Diabetes Sisters and she told me, okay, look, they have a meeting right near you and it's on Monday. And I just like went
Oh,
online and signed up. And it was amazing because that is the first time I felt
a
understood,
connection point.
is when I
Yeah.
went, yes, and then yes, and just even signing up for it gave me hope, and
Mhm.
that changed my whole perspective.
Mhm.
And, so like I said, just talking about it, whether it's to a friend, a diabetes sister, a doctor, results happen, solutions are found.
Yeah.
And sometimes just getting that burden off of you, it changes your perspective. You feel so much better
Right.
and you begin again.
And I think it makes you feel like you don't have to beat yourself up or play the blame game,
Yeah.
right? If you've brought this to attention and you've done a little bit of research or you've gotten feedback from a friend who gets it as well, and then
Hmm.
you can come and again advocate for yourself, it's really very valuable. I mean, I think my first, growing up with diabetes, I never attended diabetes camps. I think
Hmm.
I knew one other kiddo in my city who had type 1, and she was very different than me. We had
Mhm.
like different goals. We never really did more than like maybe one or two like things at the hospital together. But
Yeah.
still, it was another person who had type 1. I had
Mhm.
really supportive friends, so that network is very important. But it
Good.
wasn't really until I was an adult that I chose to attend an adult type 1 exercise camp. And I made some of the best friends ever there.
Right.
And then got involved with Diabetes Sisters because of exercise and a specific group. It was called Team Wild, that we were all training to do a triathlon together. And that connection that you're talking about, that peer support, that ability to connect and say, well, I've tried this, how about you try that? Or, this really works for this, running event or whatever. It makes
Right.
such a big difference that you're not going to get that at most clinical visits. And I don't say that as a beat up to
Mhm.
clinicians at all.
Right.
They have they have a very, very important purpose in helping
Mhm.
people with diabetes, but you're going to learn the most from a group of peers that you can connect with, have similar interests, one being just diabetes, right?
Mhm.
And then you have a lot of things to talk about, and again, be able to come back to your team and advocate for what you need, not just
Right.
be told what you should be doing, but
Mhm.
say, I've tried it your way and it doesn't work, but I've tried it this way and look at my results. And,
Right.
I think that's a really good like pat on your own back that
Yeah. And yeah, and you're right. And just all of these different resources all together are so important.
Mhm.
And that those are your people, your support group, your endocrinologist, your clinician, your diabetes exercise group, diabetes sister. I mean, whoever is in your team,
Yeah,
and they rally around you and encourage you. That's who you want.
yeah,
Those are the people that love you and believe in you and help you believe in yourself when sometimes you forget.
absolutely. I mean, if, in terms of I always think about the newbies that I get to chat with and interact with and be able to educate and kind of set them sort of on the right path. And I always like to ask what if they're struggling with something, like what are you really struggling with? What would you tell somebody now that you learned and help them decrease that struggle earlier? Like,
Mhm.
is there something that you would tell somebody from early on? I think advocacy is definitely high on your list. Uh,
Yes.
but what else? What else would you tell somebody?
Um, I think I would say keep going. If you feel lost, if you feel tired, overwhelmed, isolated, burnout, any of those feelings, keep going and know that you can do it. Take a break. Um, Go pray, journal, watch some television, get out and go for a walk, talk to somebody on the phone, read a book. Just do something to distract yourself from those feelings of inadequacy or feelings of, you know, not feeling like you could handle it. And when you distract yourself for a little while, you get a change of perspective. You kind of come back out refreshed because you haven't thought about it for a little bit,
Yeah,
and then take another deep breath and keep going because you can do it. And that really goes to anything in life. If you're feeling, not up to snuff with anything, right?
yeah,
Work, relationships, what have you, just take a break and then, gather yourself and your thoughts together. Remind yourself that you are amazing. Um, you can do anything, and you really, really can. Even when you
yeah.
think you can't, you can. And that is, in my opinion, self care.
It is.
Giving yourself a break and, you know, just don't stop believing that you can do anything. Um, Practice that self care and, you're not only doing this for you, you're doing it for the child that is growing inside of you.
Yeah.
And well, I mean, what better reason
Right.
is there?
Yeah, no, along that same line, I always say, again, in pregnancies with type 1 that I get the chance to work with, if there is a big struggle that I can definitely see, or somebody says to me, I don't even know what to do. Like, I can't put one foot in front of the other. I feel like I'm
Mhm,
constantly failing at this. I said, what's one thing that you can do? Even if it is just, looking at your blood sugar first thing in the morning, and that's the only thing that you do. It's one step. It's just
mhm,
one thing today. And then, like you said, taking the weight off and giving yourself a moment, and
mhm,
also congratulating yourself when you get through those moments of,
mhm.
okay, I did this today. I checked my
Right.
blood sugar, and this is what it is. I think even those blood sugar numbers can sometimes be overwhelming
Mhm.
themselves, and we end up doing a lot of self-judgment. And really,
Right.
I think the big thing with them, look at them as information so that you can make different choices, or
Mhm.
stick with the same choice that you made because it worked. And so that's like one step, one thing at a time. Just navigate, and each little change can help to the bigger scheme of, what your ultimate outcome is, which is just a successful, healthy you and a healthy baby. So
Yeah. Yeah. What's one thing that you wish that you had done differently or thought differently when you were, going through pregnancy while living with diabetes? Is there anything that, you wish that you knew at that point or that you could go back and tell yourself?
yeah, I think that I could go back and tell myself to not be as, I don't like the word obsessive,
Mhm.
but I was like, knowing, because of my career and what I
Mhm.
do and my education, um, I feel like I knew more than the average person. And I feel like I took a good majority of that weight on myself to
Mhm.
navigate, despite having a very good high risk obstetrics or OB team, a maternal fetal medicine team. I I can look back and say I definitely stepped on their toes because I made things all on me. And I think that to navigate a little lighter, like
Mhm.
lighten my burden, so to speak,
Right.
I would actually use them to their experience more, because I think it would have lightened my load. So,
Right.
and many of them are very, very good. And really want the best for you. So I think learning to, again, advocate and use their knowledge
Mhm.
and move forward with it, but don't feel like it's 100% on you. They're your care team, because that's what they're supposed to be doing. So don't expect that you should know how to do everything.
Right.
I guess
Right.
that would be my thing that I would go back. I also logged a lot during my
Mhm.
pregnancies. Like, I've got binders of logs, and looking back now, was it all that necessary? Maybe not. At the time, I thought that it was, but
Mhm.
I think I could have just lightened up a little bit. So
Yeah.
enjoyed being just pregnant a little bit more
Yes.
than seeing it as a constant adjustment and constant, something that I have to do perfectly, because there
Mhm.
is no perfect.
Right.
So
Right. Exactly. And, yeah, I think that's what I would say too, is just don't be so hard on yourself. Don't be so worried about getting everything perfect at all times. Enjoy this time with your baby in your belly. I mean, enjoy being pregnant, enjoy this stage of your life.
mhm.
Um, and, as a mom, when the babies are out of your womb, you worry that, oh, why am I doing this right? Am I getting, da, da, da. It just relax, trust your feelings, you have those motherly instincts and do the best you can, and
Right.
they'll forgive us for what we don't get right, and they'll learn and use that to their advantage when they have kids someday if they do.
Exactly.
So just,
Yeah.
take it easy on yourself.
Agreed. And as you said, we've been talking about just community, find a community, reach
Yes.
out, ask your providers, do you have a support group within this hospital network? Do you have a support group? Do you have anybody, some clinics have set up kind of almost like a touch point person for
Mhm.
newly diagnosed. And sometimes that can be just your reach out.
Yeah.
And certainly don't hesitate to tell your provider when you are feeling overwhelmed, because there may be resources and references and somebody that you can talk to. And that's really,
Yes.
really important. So,
Exactly, exactly, and when you tell them that you're feeling overwhelmed, try just sometimes just speaking it out loud helps you to break down what it is that you are actually feeling overwhelmed about. Is there just one area that you're confused about, or is it all of it compiled? And sometimes just talking about it helps you to get it out or to figure it out.
right. Narrow it down to just one thing again that you can kind of work on. Maybe it's the biggest thing that you can work, and the rest of it slide to the side for a bit until that's okay. And you can navigate another thing. But sometimes it's somebody that stands outside of what you're trying to do who can help you see the bigger picture,
Mhm.
kind of pick that apart. So again,
Yeah.
always, put on your big girl pants and use your voice.
Yes, yes. And again, no, you can do this. There's not a doubt in my mind that anyone here can't do this. No, you
Correct.
can do it. And, as you're working on it, you're already being a great mom, trying to take care of yourself for your baby.
Yeah. They're the
Yeah.
first steps in motherhood. So
Yep.
yes, that's
Yes,
great.
absolutely. And you've got just a wonderful blessing waiting for you at the end of this. And you're
Yeah.
going to be a wonderful blessing to your baby as well.
Agreed. Yeah. Well, anything else? This is a great conversation. Thank you, Jen.
Yeah, well, thank you. I don't think I have any other questions. How about you?
I don't think so.
Okay. Well, this has been really great. I feel supported, even in this. And I hope that, more people will join us the last Thursday of every month at 7 p.m. Eastern Standard Time, because there's lots of support to be given and
We've got lots of things to talk
encouragement.
about and help with. Yes.
Yes. Yes. Okay.
Awesome.
Talk to you later.
Thanks. Good to see you. Bye.
You too. Bye. Okay, I'm trying to figure out how to save this to the
Yeah, you have to
um,
stop the recording first. So you
okay, there
should
we
have
go.
an option to stop the recording, and then it'll ask you, do you want to save it to the cloud or to your computer?
Okay, and it says here after stopping, you'll receive an email notification when the cloud recording is ready.
Great.
So